heard a lot about hypnosis, and I wanted your experience in the exam.
I'm disappointed. I don't have good experience with hypnosis. It does not seem to help. But other people think that it does, and I just wish that I had that experience. I don't know if I'm expecting too much. I forget her name, but one of the doctors, I think she's a radiologist at UC Davis, uses this orange plastic hemostat. And she was giving a lecture at one of the conferences, and she said, "Give me your name and I will send you one." And she sent us one, and I still have it. But it didn't work for, as you know, her lecture was, staying out of the radiation, staying out of the field, so you didn't get yourself exposed. And she said they love this clip on the scruff, and the cat will lay there perfectly nicely, and I can't get that to work either. So I think it's us. I think we're not using it properly, maybe. I don't know. Yeah. Yes, and I do find that those things would work better on a younger cat than they do on an older cat. So that might have something to do with it too. I don't know. That's purely anecdotal on my part.
What is the experience like? You've done all these things to make sure that the experience here is, low stress for the pet. What kinds of things, are there any things that you do or want to do when the pet is going home to continue that experience, for like whether there's going to be medication given?
When we used to get the Feel Away sample wipes, we don't get those anymore. We would send those home, and they could, use those to wipe the carrier out the next time. We give them tips on that carrier, how to keep that carrier. A lot of times there is not one appointment where a behavioral issue doesn't come up. Most of the time it's storm phobia. So we talk about ways to do that. And again, what I tell the clients is you're not going to completely make the phobia of the storms, the fear of the storms disappear, at least not without medication. And this is most of the clients who bring it up. You can reduce the intensity and the amount of time by managing the environment a little bit. So that's another thing. We developed the house call program for the cats. And really anybody who would need that, I'm sure, would get a house call. But mostly right now it's marketed towards the cats so that they don't have to come in or endure a car ride. Just coaching people on mostly like how to get the pets here and the next time. If there's an issue at home that they bring up, talking about that and how to deal with that. Offering help. Many times they don't take it, but recognizing something in the pet, pointing it out to the owner, asking additional questions, and then, saying we can help you with that if you're interested. Many times they're not.
So a pet owner comes in and says, "Oh gosh, I just had the hardest time getting the pet here."
Mm-hmm.
Walk me through what you say and how you guide them through.
Well, I guess I would ask for a description. I don't know how to put this. For instance, we have a client named Pam who comes in, and she's been here since I have been here. She brought in her first puppy the week that I started. And I shouldn't say this either, but I haven't always liked her. But the last few years, I really do appreciate her and how she cares for her pets. But she has one dog that's debilitated, and he's over 100 pounds. She just lives up here. Even if she didn't, I would still go. And she has a hard time getting the dogs in. I know that she's how hard she tries. Can I go over to her house and trim a couple of nails? Yes. So that's what happens sometimes. We are not beyond recommending that Dr. Downs is a veterinarian that used to work for her, and we are not beyond recommending that if it's that much of a problem, then perhaps it would be better for that pet if a mobile veterinarian came to their house. I don't know that that's what other veterinarians want to hear, but if that client has multiple pets, which usually they do, the other pets are still coming to us. They appreciate the information, they appreciate the honesty, they appreciate the effort for them, and by the way, here's her card. So we're not competing with her. She's not competition for us, but certainly that that pet's going to benefit from that advice.
You talked a little bit about using the Feel Away wipes and carrier.
Mm-hmm.
What kind of advice do you give advice on, like how to keep the carrier and?
Well, we tell them not to keep it in. Don't hide it away and then get it out. You guys may think I'm nuts, but I think that when a pet hears you on the phone saying, Missy, Missy, Missy a couple of times, people go, I don't know how they know. Well, they know because you picked up the phone and did this, and generally you don't say their name on the phone, and then, oh, by the way, the carrier comes out. So we recommend that they keep it in a place where it can be seen often. Wipe it down with Feel Away. Some people will recommend putting food in there and have the cat go in there and eat. I think that's probably more of a long-term getting the cat used to the carrier kind of thing. I don't think it's a bad idea. I just don't know that it's going to work for the event, when an event comes up where the cat needs to go to the vet. Sometimes we have to tell people how to perhaps wrap the cat in a towel. I don't want people to come in here without a cat in a carrier. It's just so dangerous, and we still have a few people who will come in with them carrying them. So it might be a difference for safety between your cat freaking out and getting loose in the parking lot, and I would rather have it freak out going into the carrier. So lots of times people do not want me to let the cat out of the carrier in the exam room when they get here, which I think is a little, they think it's going to go through the ceiling or something, and usually the cat's just so grateful to be back it wants to go sit under the table. So yeah, they'll say, oh, he's never going to get back in there.
Is the acclimation process at all
you mean when they come into an exam room?
Yes.
Sure it is. So my usual process is to bring the cat in and put the carrier or the cat on the table. I feel that they like to be high, at least when initially, or kind of when they're trapped in that carrier. And then I'll open the door. And a lot of times they'll stay in there. Sometimes they'll come out, shooting out. And then sometimes they'll check it out. We use that Feel Away. Usually the receptionist will have put a Feel Away towel over that carrier. So they're already it takes a few minutes for them to relax. That and thunder shirts, I am always surprised when they work and amazed at the same time. And so, like I said, I don't make a lot of eye contact. I certainly don't touch the pet. I'm talking to the owner. One of the things here is the computer's here and the owners are over here, so that's a weird thing where I'm not looking at them. So I move it around like this. So the cat is usually on the table behind the computer so I can look at the owner while I'm talking to them. And then, all the questions, their history, taking their history takes a few minutes. And then by that time, the cat is usually on the floor. We have the cat trees in the room. I've had one cat investigate, and I still go in there every morning and spray those things with that Feel Away, hoping that somebody will climb the tree one day. We do use, in one of the rooms, we have a little toy that hangs. It's like meant for a counter, and a lot of the cats will play with that. So it's just a matter of them going, okay, this isn't so bad. And right now, we don't have the soundproofing in yet that we were planning on getting. So right now it's a little bit tough because of the echo. So as far as getting them acclimated to the room, if there is a barking dog up here, I have asked our receptionist to put it back in my room, my little behavior office. It's got a little couch and chair in there and a carpet, and they can wait back there, and they're probably not going to be barking as much with the door shut. So, but that's got to be terrifying for a cat. So.
You talked about the storm phobia for a minute.
Mm-hmm.
I feel like a lot of people, this thunderstorm last night, my dog freaked out.
Mm-hmm.
It's a common story. So when you're in the exam room and somebody mentions it, how often are they already wearing a thunder shirt because you guys fitted it up front, or do you take them over? What is the experience? What is the recommendation when you hear a behavior problem like that?
Mm-hmm.
How do you guide the client through to the solution?
Well, we ask a lot of questions because we want to gauge how severe. I think they're all serious. I think they're all serious because they grow, but how severe it is at that point in time, what the owner is talking about. So a lot of our patients can use a thunder shirt and may see some relief from that. The problem with storm phobia is that most often it will have developed by the age of 4, but it hasn't become annoying to the client yet, the owner. So they're not really noticing it, or they don't, I don't want to say not care, but it hasn't become a problem, or they haven't noticed, or they haven't empathized enough with the pet to realize they're in distress. So so it's we ask about that a lot, about where they are. Is it hiding under the bed and howling? Is it drooling and hiding in the corner? Some pets will kind of take care of themselves and go down to the basement where there are no windows. I had that the other day. So it depends on where it is as to what we're recommending. Maybe a thunder shirt, maybe close the windows, turn up the radio, give a distraction, sit with your pet, something, and try this thunder shirt. That pet, though, is probably the reason storm phobia comes up so much, is because if I notice it's nervous, their CSR notices it's nervous, anxious, it's getting that thunder shirt on right away. And then what they say is, oh, maybe that would work at home for storms. And so, that and fireworks. So, or when people come over, that's probably the number two. So, if the client is describing something that is more than what the thunder shirt can be effective, it can affect, we may go on to something else from there, something, some sort of medication.
What drew you to behavior?
I don't know. I have thought about that so much. We had a technician work with us, and it's probably been a good 10 years ago. I did not like her necessarily, but she had studied with Julie Shaw at Purdue. And she was the one that brought in the peanut butter and the biscuits we never really kept those in the back, and we certainly didn't give them during nail trims. And that's how that started. And she would get really frustrated with us, and I think it's probably how she introduced it to us. And I try really hard not to be kind of a ramrod with it. I think it's more helpful, and I learn at least those lessons through example, to see someone else's success, or try this and see if it works, not this is what you should be doing. So that is my first recollection of how this started. I don't know. I just Gentle Leader came out, and I went to learn how to do that. And I'm sorry, I'm totally lying to you. I know how I got interested in behavior. It just hit me. But I went to a Gentle Leader seminar at the Midwest Veterinary Conference. Dr. Hunthausen was there doing it. We needed to know how to fit them. And so I went and learned that, and then there was the harness that came out. The harness was for my bulldog. I had had 5 bulldogs, all wonderful. The 6th one, she had been my first, she would have been my last. She was occasionally aggressive towards my 5-year-old daughter, who she was given to. It was her birthday gift. When you would brush her, she would try and bite the brush. She liked to ride. We used to, we bought a Volvo station wagon for these dogs, so my daughter and the dogs could be safe. And when you would want to get her out of the car and she didn't want to go, at that point in time I was pulling her by the collar because I didn't know better, and she would roll over on her back and try and bite you, and I would then get mad at her and put her in that submissive hold that we used to do because I didn't know better. So there was a guy in town named Dr. Tuber, and he had a place called Pet Behavior and Training Services, and I didn't see him, but I took the dog in to see him after I had a trainer to my house who told me to kick the dog in the chest when she jumped up on him, on people. I thought, that's not working, and I don't know what gave me the idea other than we had been referring people to this man over the years. So I took him there, and we're sitting on the couch, my husband and I and my daughter, and the dog would sit, and she would kind of gum my, chew on my hand, and I would take my hand away and say no. She would stop, and I'd pet her. So I just rewarded the dog for doing it. Put my hand back down and talk, and she would be doing it again. And so we're in that cycle. They pointed out so many things to me that were so simple and so obvious to me that I had never seen. And it's still that way. When I go to see, Dr. Horowitz or Lisa Radasta or Julie Shaw or somebody give a talk, and they point these things out, many times I am just blown away about how I didn't see it or never thought of it, and that is what got me interested in behavior, was my own frustrations, my own experience with it, my own someone giving me this to saying this is this and this is what's happening, this is what you need to do, and it was solved. It was solved. That's what did it. And I am so sorry that I didn't remember that, because that's not honoring that dog very much. She's gone now, but you know, she was a constant learning process. So yeah.
What was her name?
I'm sorry, I've had a lot of them. Her name was Dancer.
Dancer.
Yeah.